This is a picture of Osmundo Saguil, my dad. We were at the Chopra Center. He came along, celebrated my graduation on the beach. And today's topic that I want to talk about is on counseling. Usually when I see patients in the office and I bring up the possibility of having my patient see a behavioral health specialist, that could be a licensed social worker, a counselor, a psychologist, a psychiatrist, a pastor, a rabbi, a confidant, even an exercise physiologist, or a physical therapist. The bottom line is, when I suggest counseling, it's usually met with some kind of resistance. And in 25 years, I've been trying to figure out, why is counseling such a taboo when it comes to making lifestyle changes. Everybody is usually okay with saying, I'll change around certain nutrition practices, or I'll exercise more, or I will try to detox my life. But when it comes to, hey, I want you to sit down and get some feedback from a behavioral health specialist, usually I usually will have, do I really need somebody like that? I'm crazy? Or I will not do that. No. And for those who say no outright, I won't argue. I'm not going to encourage something that will just be causing some kind of conflict between myself and my patient. But I will enlighten. My job is always to teach, to empower, to change, and repeat. That's my life goal. Sounds pretty bland, but when you consider that it always changes with everybody, it's kind of a challenge. And definitely suggesting behavioral counseling is a big challenge. I mentioned my dad. This is the picture that I usually take with me hiking of my dad. He just passed away August 15, 2015. And I miss him terribly. And I'm still going through the healing process of saying goodbye. My mom is on the other side. I took her with me to a couple of my big hikes, Yosemite, Grand Tetons, Old Faithful. And now, unfortunately, my dad's going to be coming with me this way. But I'm pretty decent when it comes to yoga practice, meditation, calming down, always thinking that the cup is half full. But I also, when it comes to sorrow or loss of a loved one, any kind of trauma, even a diagnosis of a medical condition, this can trigger a emotional change in anyone. And sometimes when we go through emotional changes, even, for example, traumatic brain injury, a concussion, when somebody goes through that, what we usually experience is that a patient might display personality changes. And you might think, okay, he's just getting through that. But with the personality change, it's sometimes difficult to see, self-introspect, or see that there's something wrong when you're analyzing yourself. And that's the big problem, because especially when you have a professional, my case included, when you have a professional who has been around the block and knows about the ins and outs of medical disease, about the human psyche, about how DNA works, and then that same person goes through a trauma, just like everybody else, you can expect that the same, say, stages of depression will come about. And here's the big catch, is that will the practice that I do, I'm just using myself as an example, will the practice that I do, which is I think better than the average person, will that be enough to get me through to self-analyze, possibly fix some weaknesses, and possibly develop some coping skills that I've never thought about before to get away from the weakness, or to carry me farther and farther from the traumatic event, which is, in this case, my dad's death? Will all the things that I learned fall into place if I implement them, and will I get into a safe haven of a year or 2 years without suffering any psychological damage, or without having the psychological damage that's coming affect my medical condition or my exercise, my nutrition, my well-being, my thinking, my processing, my problem solving, especially when I'm going to see in the immediate care center one new patient every 10 minutes. I have to be on my game to problem solve. And I have to kind of draw back from all the knowledge I had from before. And the cool thing is with the brain, if you have done this long enough, and I've been in this for 25 years, then different parts of your brain can kind of problem solve the same issue. For example, you know how to run away from a fire. There's several different ways to do it, all the way from the reptilian brain to the more executive thinking of the functioning of the brain. But sometimes when your the brain tissue isn't functioning properly, either low serotonin, poor sleep, emotional distress, menopause, medical disease, a loss of a loved one. When those things have happened, then the electrical circuits and the chemicals that usually fire off in the brain won't be firing as rapidly or as efficiently. And if you have enough of the burned in tracks, enough of them to kind of take care of the problem solving, that's cool. But when you're trying to problem solve a new problem, a dynamic thing, somebody coming into the office, problem solving if you're a CEO of a company, sometimes when you go through the emotional change that comes with death of a loved one, loss of a job, all those things I mentioned, it won't be as easy. And that's that there lies the problem, is because even if you're gifted or you're well versed with what to do, when you go through an emotional distress, it sometimes is very difficult to look at yourself, analyze what the problem might be, where we can fix things, and then implement the change. My counselors, my social workers, my psychologists, my psychiatrists of today that I use are very astute with different techniques that have been tried and true with the new advent of positive psychology. There's a lot of, it's more than just cognitive behavioral therapy, CBT. I'll put a list of the fancier things that have come up in the last 2 decades to help a person get past where they're emotionally stuck. Because it's so complex, it really requires, I know a lot of great techniques, but I don't have the skills or the time to really dive in deep with a patient. That requires frequent visits. That requires a sense of trust between my patient and the behavioral health person I send them to. It also requires, sometimes if there's no great feedback between the two, then I might have to find somebody else. But I usually will try to find somebody that will be a good matchup. And once that matchup is made, then I trust that person will do their best to come up with a solution, find the problem, define the problem, define the weakness, look at the strengths, and then come up with a solution or a plan. And if that plan doesn't work, reassess it after a while and replan something else. It's very dynamic. Even with food, it's not just picking up the Ornish Spectrum diet or the Paleo diet in a 2-inch book and following it. If it was that easy, everybody would be losing weight, but it's not that easy. In fact, with regards to diet alone, no one usually reads that whole text and figures out the whole theory of the diet. They just hear from friends, try to implement a couple things, and then usually there's failure at the end of a year. Because it's hard. You have to have an outside source to watch you, what I call a coach. And you have to have that coach kind of reformulate, and you have to answer to that person to make sure that you're following in suit. Because it takes a little bit of time to lose weight and maintain it. Well, definitely it takes a little time to get on the right track as far as emotional stability. You have to, again, you got to find the weaknesses. You have to admit to the weaknesses. You have to give in to the questions and answers of a stranger, hopefully a stranger that you trust because I trust them. And then you have to trust that the plan will work. It's very hard to continue on with the plan. My challenge or my explanation would be, for those of you who I've said, try 5 to 10 minutes of meditation twice a day for 21 days straight. If you follow Deepak and Oprah's 21-day meditation challenge, you'll probably get through that. Most won't be able to go the whole 21 days, and that's just with guided imagery online. Imagine if you're seeing a counselor every week and then you have to do your usual 50 hours a week, you have to do your usual child care or your parent care or whatever it is you do. Then they have to squeeze in, with the emotional distress you've been through, you have to squeeze in some new practice. Well, it's kind of hard, and that's why usually it's better to have somebody watch over you. Not just me. You can come see me, I can come up with a lifestyle plan and, if necessary, help make changes to the diet to get the behavioral health sessions more successful, or give supplementation in the form of vitamin deficiency or certain herbs that will, again, make it better for you to carry on and carry through with the plans that the psychology or behavioral health person can put together for you. If it comes down to it and it's really that, if you're in that much distress, then sometimes prescription medicines are necessary for a short amount of time while you are in the counseling, the behavioral therapy. Again, the behavioral therapy will get you to realize the ways out of your predicament, but sometimes it's hard if you're deep into your emotional distress. If you've been hit by 2 deaths at the same time, 2 deaths back to back, you've been hit by job loss, major medical diagnosis, and then a loved one who's died, it's really hard to maintain focus. So sometimes medicines will kind of get you there. Sometimes medicines will make you go to sleep, keep you asleep. Sometimes medicines will keep you awake. Sometimes medicines will give you a better outlook so you can do your usual job, instead of taking a 2-month medical leave, which is without pay, and then trying to dedicate yourself to seeing a counselor every couple of days. Sometimes it's not practical, but if it's bad enough, if you wait, you will be put into a hospital and you will be committed. So those are terrible words, and we don't usually do that anymore because we're so good at kind of finding things before they get to that extreme. But it just comes down to admitting there is a problem, and then trusting in me and the behavioral therapist when we go through questions and answers. It's very hard to expose yourself, expose your weaknesses, expose your feelings. I think it's hard unless my patients have trusted me for a while. Sometimes I can get, if the bond between myself and my patient is good enough first, straight out of the gate, then they'll trust me, and I'll bluntly ask them, about personal questions, and in efforts to come up with a solution fast and understand the dynamics of this person that's in front of me. If it seems to be too personal, then I'll pull back, but eventually we're going to have to get to that point. It's a learning process for everyone, and as long as you're patient, then we will get through it. If the disease process is too severe, we can't wait. We have to initiate treatment or get a little deeper with this. If it's severe, then we have to be severe with our interventions, medicines, herbs, even ECT. But whatever it is, everybody has a different, it's not just one size fits all. It's not cookie cutter. There are algorithms, there are suggestions for the general population, but this concept called the ecological fallacy says that you can't apply general statistics to the individual. So when I close the door between me and my patient in that room, then it's just me and the patient. Nothing, because of HIPAA especially, nothing goes outside that room, nothing gets shared with an employer, unless I think that you're a danger to yourself or to somebody else. But that's not usually the case. So everything is in a trusted environment. So if you trust me with your health, then hopefully I can do my best to formulate a way out of the problem. And it doesn't just, obviously, it doesn't just stop with the psychological or the behavioral health. As you all know, there's thinking, eating, and activity, and all three, I think, are intertwined. And if all three are if you're on your game with your thinking, your eating, your activity, there's no reason why you shouldn't be able to fight the biggest diseases, take care of the biggest challenges of your life, and help others get better too. If you manifest good health, then other people will also want to be just like you. So the concept again of teaching, empowering, and changing, then repeating, is real important, not only for me to get to my patients, but I expect my patients to also empower other people. whether it's with the word of mouth or sending over to me or my other friends. I think it's important. So hopefully this helps with regards to why I believe counseling is so important. Please consider it, and even if you don't seek it out with me, I'll put some links on ways you can find a decent psychologist, behavioral health counselor, behavioral practitioner in your area. Sometimes you can go to therapists, Reiki therapists, acupuncturists, Ayurvedic yoga practitioners, but it's harder to find a good one of what I just listed than it is to find the ones that are followed and referred to by the medical community, just because there has to be a paper trail of credentials with the Western way. The non-Western way, you don't have to have any credentials, just word of mouth, which is good in some cases, but you are taking a little bit of a chance. So I have my assembled Avengers, my assembled special forces who I think have done a great job, so hopefully you'll trust where I send you.